Welcome to the Medical Report podcast, where we bring health to your ears. We are your hosts, Zenzele, Olu, and I am Anita. We have a special guest as well today, Dr. Tomi Mitchell. This podcast is brought to you by our sponsors, Integral Care Medical Services, New Life Rehab, Graceful Hands Rehab, and Bantu Cola. Our podcast hopes to help the community learn more about health, but we do have a disclaimer that all medical advice shared here is not an adequate means to diagnose or treat you. We do recommend that you seek medical attention from your healthcare provider if you want more guidance on your health. Or if you'd like an assessment by one of us here on the panel, you can reach out to us through our social media pages. If anyone in the audience has any questions for us individually or about our topic today, please feel free to leave your questions in the chat and we'll answer it in our Q&A segment later in the show. If you're watching this after our live show ends, feel free to ask your questions in the comments as well, and we'll be sure to get back to you. Be sure to like and share this video because we want to feel the love. So let's get started. So stress is a heavy topic, but we're going to be talking about that today. We're hoping to bring real conversation, light, hope for everyone listening. But because we've all been there at some point in our lives, learning to cope with stress in a healthy way will make you, the people around you, and those that you care about become more resilient. According to the CDC, stress can cause feelings of fear, anger, sadness, worry, numbness, or frustration, changes in appetite, energy, your desires, your interests, difficulty concentrating, making your decisions day to day, difficulty with sleeping or with nightmares. You may have some physical reactions like headaches, body pains, stomach problems, skin rashes. And you can even have some worsening of your chronic health conditions and your current mental health conditions as well. And it's common to also see increases in the use of tobacco, alcohol, or other substances. Mental health is important more than ever since the world began experiencing this pandemic together. Outside the pandemic, people just have their own issues or mental roadblocks they're trying to get through. It's so important that we make time to check in on ourselves and be proactive about our mental health. And sometimes our mental health issues aren't simply prayed away or yogaed away, like some believe. We really have to put in the work, whether that be in therapy or with mental health wellness coaches, to identify our weaknesses, our emotional traumas, and heal from them to truly move into a more positive space. Now that we have a better understanding about stress and how it can affect us, Zenzele, what do you have for us today?
All right. We have some statistics to look at. Black and African American people living below the poverty are twice as likely to report serious psychological distress than those living over 2 times the poverty level, as well as adult Blacks and African Americans are more likely to have feelings of sadness, hopelessness, and worthlessness than other cultures in stressful situations. We as a people, just in general, are highly impacted. And we tend to think that we're okay and we're going to make it through every day, but it's just not always that way.
Right. It's very common in our communities to have that praying away mentality.
Mm-hmm. Yeah, I have a statistic here that says 16%, which is 4.8 million of Black African American people reported having a mental illness. And 22.4% of those 1.1 million people reported a serious mental illness over the past year.
Oh. Yeah. Olu, you got some facts for us?
Do got some facts for you. Did you know that 64% of households with healthcare workers said that they worry or have they've worried or have stress over the coronavirus, and that's caused them to experience adverse impacts to their mental health and well-being, such as sleeping, eating, and alcohol consumption, as compared to 56% of households prior to the pandemic. Nurses and physicians were already prone to experiencing burnout and suicide.
Yeah. I mean, as a healthcare worker, all of us have, experienced some type of, stress from the pandemic. I know for me, I was just more so worried about bringing COVID home to my family.
Right.
Of course, care of COVID patients, but I mean, that increased worry in addition to, I mean, taking care of the patients that we take care of and seeing everything that they go through, and then having to come home and worry about whether you're going to be the carrier of the virus. That's an extra stress added on.
Yeah, early on in the
Absolutely.
pandemic was really tough for me. I just felt funny even hugging my daughter. I'm like, do I still have it on me? Maybe somebody coughed on me or something. So, I make sure I still do it, but I make sure I take a long shower when I get home. And I'm
Yeah,
still kind of like, did I get every single spot? Maybe I
right.
was a little too close to this patient today. Maybe this person, coughed on my arm or was breathing on my arm. But it still worries me.
Mm-hmm. Yeah. When I come home from work, it's like taking clothes off, shoes off, taking that shower, just making sure that you're trying to be as clean and as possible.
Yeah, one of my dearest friends, she's a hospice worker, and she literally comes to the garage, declothes all her items right there in the garage, and then comes through the garage and into the home.
Mm-hmm. That's what I do too. It's important. So we have a special guest speaker today, Dr. Tomi Mitchell. So Dr. Tomi Mitchell is a Canadian family physician for the past 10 years. She's very passionate about mental health and is currently a mental health coach. So everyone, please welcome her. Yay.
Thank you.
Welcome.
We're so glad that you were able to join us today. So can you tell us a little bit about the type of clients that you coach?
Thank you for the introduction. So my name is Dr. Tomi Mitchell. I coach clients, diverse clients from like young adults to those in retirement age. And because mental health affects every aspect of our life, I have the joy of tackling all kinds of concerns they may have, whether definitely it's burnout, which leads to productivity issues, which can lead to relationships challenges. I even delve into relationship stressors that couples have, and just to name a few. So it's very diverse, which keeps my job very interesting.
Yeah, I'm sure. So when coaching your patients, can you give us some coping strategies that you use for stress?
Definitely, the first thing before you can really have a strategy is to identify what is actually stressing you out. Is
Right.
this an actual real thing or something that you're fearful of? Like, what is it? And kind of take it in perspective. Like, really, I always ask people, like, what's the worst thing that could happen? And then haven't you overcome similar things? So that's the first thing, perspective. Don't give it more energy than it needs. And then strategies, which are very straightforward, but accountability. So whatever you can do to mitigate the stresses is really important because a lot of people want to just will it away or pray it away, which is great, but faith without works is dead. So you actually have to do something. Also, in order for you to be on your best game to reduce your stressors or at least reduce the negative response to stress, you need to be physically active. I recommend 5 days a week, minimum 30 minutes of like getting that heart moving. And that doesn't mean just walking further away from your parking lot to your office. It's a
Hmm.
whole lot more than that.
Yes.
Okay. That's a nice strategy, but it doesn't cut it.
Right.
Right. And then the other piece is your diet, your food. I don't prescribe to any diet, but I do say eat a rainbow and hydrate lots. And on your plate, a good two-thirds to half should be vegetables. Carbs should be like a little bit and protein. But hydrate, hydrate. That's really important. Yes, things like yoga, meditation, they are great, but I think that often distracts us from actually dealing with the issues and creating steps and strategies to overcome the specific challenge because you did the homework, you identified what is causing the stress. And then also seeking a therapist, seeking a coach, um, just talking about it to someone who will keep it real and help you stay accountable. That's the thing. This whole like, you're fine, do whatever you want to do, you're a rock star, that doesn't really work. You have to be real and address the concerns so it doesn't become a problem. So that's basically the framework for my strategies. Definitely, there are more things we can fine tune it with, but that's a great foundation.
Yeah. So when a patient comes to you and they're just really feeling helpless or just down and depressed, what are keys that kind of help pull them out of that rut that they're in?
Definitely. So after we've identified what's the concern is, we ask them, where do you want to be in life? Like if you could have this magic wand and change a specific thing in your life or your situation, what would it be? And I'm not talking about get a haircut or try a new restaurant. No, I want larger than life. Because if your goals and aspirations are not larger than life, the weight of this world will stress you out. It will pull you down, right? So you have to have a passion and purpose. With passion and purpose comes happiness. And then, yes, there is a place for medication. By all means, you might need prescriptions. That's okay. That's a foundational piece, but you gotta do the active work.
Yeah.
Okay, you gotta do it.
Yeah, and I think a lot of times I've had patients where, they think that medication is the only key, where they'll just say,
Right.
I have this feeling and I have to be on medicine and nothing else is going to stop. Like medicine
No,
helps, yes, and I agree. Sometimes some people do need to be on it long term. It just depends on the patient. But
definitely.
at certain points, sometimes if it's like an acute depression going on, where there's like a sudden life event, you may need medication to help pull you through that temporarily. But putting in that work as well with therapy, along with the medication, is also key to helping stay off of it long term.
Definitely. The other point is feeling is not wrong. And this applies to both men and women. It is okay to feel sad, feel frustrated.
Yeah.
That's our body cueing in on something. And an issue that needs to be discussed, which I often discuss with my clients, is this issue of the inner child work and learning who we are inside, what childhood experiences have triggered us or caused us to see life through a different filter that might not be necessarily healthy or clear. That
Right.
is really important. So, again, that's part of the foundational piece that has to be done. We can't just throw our skeletons in the closet and think they're not going to come back out. They will. And they'll come out with vengeance, whether it'll show up in your relationships, in your work, in your health, in your finances.
Yeah,
We got to deal with our issues. So,
that's true.
and we all have issues, like every one of us. Like I tell people, if you have a heart and a brain, you're going to have mental health
We
challenges.
all
I
got
sure have. We
problems.
all do. As long as you're breathing, you will. So let's like
Yeah.
throw out that like taboo. It doesn't
Yeah.
make you crazy. It's just part of breathing. We
Right.
So,
all have mental challenges. Just
so
don't
a
let it
lot of
become a
times,
situation.
yeah, a lot of times people will say, "Oh, well, the relationship's the problem. Once I get rid of the relationship, my problem's gone."
No. The
Or once
problem
I
with
get
that
rid
is
of
they're still
that
there.
person in my life, the problem's gone.
Yeah, no.
Yeah. Do you
I
ever
have a
find
question.
any mental health issues when you're working with therapy patients, Olu? Like
Uh,
any
all,
roadblocks? Any
all the
roadblocks in
time.
therapy?
All the time. You see a lot of patients who are suffering from depression. Um, uh, a lot of people in the early stages of dementia, but specifically related to depression. You meet people really kind of at their worst point in life, and as a physical therapist, you feel like you have to become, a therapist. And sometimes my sessions are just, all right, let's talk about, how you feel in this stroke that you had, and
Yeah.
how things look going forward, and how we can get there. Sometimes that might be all we'll do for the first week or two, because that's all you can really get out of people. If they're not there mentally, then I can't motivate you to do exercise realistically or
Mm-hmm.
anything functional as far as moving around. I did have a question for Dr. Tomi.
Sure.
Um, Specifically with like black men, if you see a friend or a spouse experiencing like a stressful episode, how do you approach that particular person to talk about it? Because I know we're not easy to talk to.
Okay. Well, the first thing must be in place. You must have a healthy relationship with that person. They need to know that you care about them truly and that you have a track record of being honest with them and confidential. Okay. They have to feel safe. Otherwise, they will not disclose to you. Number one. Whenever I need to discuss a prickly subject, especially with a partner spouse, you first give them permission to talk to you. A strategy I like to use is Okay, hey Joe, is it okay if I tell you something that I've noticed about you? Do I have your permission? So they're asking you to bring it on, right? Versus you give them unsolicited advice. So, usually with any prickly topic, starting off with something positive is like, I know you're a great father. You love our kids so much. Okay. So, first prep them. Don't be like, I think you're a terrible father. You yell at the kids. You got daddy issues. You need to stop it. Like, no, no.
That is
Okay.
exactly
You
right.
first praise them. You make them feel good and listened to. And
Yeah.
then you gently tell them. And it's not a subject where you have like verbal diarrhea and just dump it on them.
Right.
You deal with it over time and model the kind of behavior that you want from your spouse. Because you can't tell them, I need you to do this, but you're off acting crazy. No. Okay. So that's what you got to do.
It's
All
true.
right. We got a message from Lucius. We men deal with mental health and stress issues more than we talk about as men,
Yes.
or even as it is spoken of in general. Men tend to hold this in and not talk about it due to pride and such. What can men in this position do to open up and reach out to ask for help?
Definitely. So, I love talking to my male clients. They're like adorable. Like, we all have this inner child, and honestly, they need a safe place where they can really share their feelings. And it's just creating it and knowing that, what, showing emotions and asking for help is a sign of strength. When you don't, it's a sign of weakness, to be honest with you. But you got to find the right person to talk to, right? Someone that you feel safe, someone that you know that your words are going to stay right there, but they're also going to give you some real advice. So men, like, show your vulnerability. It is okay. And if you feel like your partner cannot handle that, you got to rethink the relationship because that's not healthy. So talk to them, but we all got to be on the same page. We all have feelings. We all get sad. We all get frustrated. We all have fears. And just really recognizing that in our relationships is so important. Men do fear, and men are, ladies, if you listen up, okay? Your man, this is an analogy, okay? No disrespect. Your man is like a little puppy dog. He just wants to get his ears scratched and said, "Oh, you're such a good boy."
Oh
If you
no.
could just figure this out and put it in your
Am I supposed to
relationship,
tell them that?
yes, the truth, I'm letting it out. He just wants to know that he's doing good and you're proud of him.
That's it, huh?
It's
That's
true.
it. They want to be affirmed.
Oh, Lou, do
Oh,
you have something to
Olu?
add to that?
Tell me,
Yeah,
Olu,
Olu?
isn't it?
Oh, Lou, how do you feel about that
We,
statement?
we are not puppy dogs. I have to
Okay,
say this.
but you are the cutest little things. You
No,
get
no,
so
no, no. But
excited.
But we get what you're
I,
saying,
I can.
though.
I mean,
Yeah.
I can do this. I can make this suggestion as a man here. I think the easiest way to kind of get us to open up is to we need to be maybe doing something that we find enjoyable and we're already relaxed. Like
Yes,
some of my best conversations with some of my guy friends, as far as like emotional things, we're sitting down, relaxing, maybe watching TV.
yes,
We're out fishing. We're doing something relaxing where we're already relaxed enough where we can bring that part of us out of there. But we
yes.
don't, we don't, we don't need treats and rubs on the head.
No, but you know what? That relaxing piece, like going golfing or fishing, that's the analogy piece. You got to be
Yeah,
in the zone, right?
yeah.
You got to
I,
be
I get
relaxed.
what you're saying.
Yeah,
Yeah.
but no disrespect, man.
She said, pat them on the head.
Yeah, like show them some love, whatever
Right?
their thing is,
That's true. But I mean, I
right?
think it's just coming from a place of love as far as like
Yeah,
especially with your wife. Like she's gonna be that person that you're able to just kind of relax
Right.
around and
exactly.
just she'll rub your head.
Yeah, or
But at
whatever
the
it
same
is.
time, at the same time, we as women, once it is open, we can't use that as our opportunity to hold that for later. Using that as an opportunity to slide in what we really want to say, really want them to do, and
Hmm.
to listen. I think we as women tend to less listen, and it's something we could focus on more of.
Yes.
I think
Looking
that's
at you,
all
Anita.
love. What? Why me?
Because you
Oh,
look like you do that.
oh,
Olo pulling jokes now.
I know. All right, we'll bring it on.
do we have any other questions from the audience today? If you do have any, you can go ahead and drop a question below. Us, we'll just keep it moving. But so yeah, so what are some coaching you before you had spoken to us about the C's?
Yeah. So really, in order for you to have, it's more about resiliency, right? You have to have a sense of competency. You got to have character. You got to feel that there's a community, that you are appreciated, right? You have to have great coping strategies. So really, there's 7 C's of resiliency. And it was originally brought up by a pediatrician, but I mean those C's are very applicable to adults, and that's kind of another talk I do. But you really have to believe in general that you are competent, you are able to learn, you're bringing in skills, you are valued. You got to have those foundations.
Yeah, I agree. It's very important.
And let me
So,
just back to the other, can I just add one thing? Women, when it comes for women, I made an analogy for men, women are no different. They want to feel that they're appreciated, that they're loved, that they're beautiful, that their contribution, it doesn't matter how small it may seem, that you see it. Like when you come home and she's trying to cook your favorite meal and it might not been the best, you first say thank you. Not like, what is this? No, you could crush your heart, right? It goes both ways.
just be glad you didn't cook it.
Pardon me?
I said, just be glad you didn't cook it.
Exactly, right? Be glad we made the effort. And then maybe so you didn't like it, just work it together. Maybe you participate in the cooking activities,
Yeah.
right? And bring in your spice. So it's both ways, right? And the key is knowing your partners, or even in professional relationships with their love language. How can you communicate in a way that they will see that you care? That is the key. You gotta learn those things. You gotta learn the languages, and it applies to our children, our partners, work relationships. It's relationships. You gotta know what makes the person tick.
Yep. And being sensitive to what their triggers are.
Yes, that is really important.
Yeah.
So, Dr. Mitchell, there's a message that says there are days when stress is high, and I know that the next person that I talk to will get all the smoke. I don't want that to be my wife, so I'll avoid her in order to not give her any smoke. I am someone who just shuts down and goes quiet, so I won't verbally hurt someone. Is this okay?
Okay, I really appreciate your question. The key is communication. Okay, so you need to communicate to your wife that, sweetheart, I love you so much. I'm just going through a moment right now, and I just need a little bit of time to decompress. It is nothing against you. Because what happens when you sit in a corner, they're going to think something they did. And then she might snap. And then it's like, you're upset, she snapped. That's a recipe for disaster. So the key is communicating that, sweet babe, whatever you call her, I'm just having a rough day, but, I just need a few minutes or back in an hour, I'm just going to go hit some balls at the golf driving range. My husband likes to hit balls with sticks anyway. And whatever it is, you got to communicate. Okay. And if there's something that you need them to do that will make you feel better, then you let them know, whether it's, I don't know, soul food, whether it's just like
Whatever.
whatever, just time to just chill in front of the TV, like whatever it is, you let them know. And as a partner, be receptive to that.
Now, I do have a friend that I know of who suffers from anxiety, and
Yes.
it's constant. They're on medication, but they're very private and secluded with their personal thoughts and ideas and feelings. And then, how do you get out of that?
Definitely, that takes some time. Again, foundational piece is what's causing the anxiety. Is it generalized, which basically means pretty much everything? Or is
Right.
there a specific concern? Maybe it's fear of death, because if you ask the questions deeper, it's because someone in their family died or there's been a lot of cancers. So find out what the problems are and what proactive steps they can do to alleviate the anxiety. Because just sitting there in fear doesn't help anybody, right? So you got to identify what the concerns are. And then with somebody who's constantly anxious, medications are important, and also the right medications. There are so many different medications, and sometimes we have to try 3 or 4 prescriptions or a combination of, one or two before we find one that really gives them that. I call that, you guys, the way I see medications for mental health, just think of it for vitamins for the brain. Maybe it's some serotonin, dopamine, mismatch. It's just a vitamin. It's
What it
all
is.
good.
Yeah.
Let's not make it spooky. But really identify what the concerns are, what they can do actively to address it. And when they're anxious, there's techniques, from breathing techniques. Perhaps that's when they want to meditate, pray, go for a walk. Sometimes just even giving love and giving affection and getting that in return, that helps too. The oxytocin, like, it's just, there's many ways around it. And also, obviously, talking to somebody who understands this topic and who can help them.
Yeah. All right. Well, it's time for us to wrap it up. Thank you, Dr. Mitchell, for joining us today and sharing your words of wisdom. How can the audience reach you if they would like to reach out?
For sure. So Instagram at mental wellness coach underscore. So mental wellness coach underscore. Also, if you type Dr. Tomi Mitchell, you'll find me. So the website is www.holistic with an HOLISTIC wellness, 2 S's, strategies.com. So the easiest is definitely Instagram at mental wellness coach underscore.
Awesome. Well, audience, we hope you tune in again with us in 2 weeks. Connect with us and our businesses on social media at Bantu Cola, at Integral Care Med, at New Life Rehab, and at Graceful Hands Rehab. Those are all Instagram or Facebook. If you're watching after our live session has ended, you can still leave your questions in the comments below and we'll get back to you. If you have suggestions on a healthcare topic you would like us to cover, send us a DM. We're always open. And if you'd like to be a guest host, send us a DM. In the
Yes.
meantime, cope away that stress, and we hope everyone stays well. Bye.
Bye.
Bye. Thanks for tuning in.